The last thing that we're very against, and this is more of a policy, but we are against people drinking and using scheduled drugs. We're against cannabis. We're not against CBD oils and things like that, but against cannabis and scheduled drugs. We are also very against, and we try very hard not to do this, is give, let's say, a tranquilizer with a narcotic. And here's what happens, is if we do that, there has to be very special circumstances for that, because what will happen is you get a person that takes a narcotic, he takes Xanax to go to sleep at night, and then he takes a couple shots of alcohol. All three of those suppress the vagal nerve brain centers that make you breathe in the brainstem, and they die in their sleep and bad things happen. So we're trying to be very careful with that. There are certain situations where it's needed, but many times like this, it is most of the time it's contraindicated. The last thing I wanted to mention, all of our patients who are on narcotics, several things that we do. Number one, they are all assessed for a sleep problem, a sleep disturbance, and for a serotonin dependence issue. Because most of these people with chronic pain or chronic narcotic dependence, it not only affects the mu receptors, but it also, their serotonin levels get lower and lower, they get depressed. And when your serotonin levels are low, bottom line, you will experience the pain double what you do if your serotonin levels are normal. So most of these patients are started on a serotonergic agent. Those patients are started on a serotonergic agent, they have to be seen every 6 weeks. That's our plan. They have to take it, and we watch them very, very carefully with that, because we want their mood and their serotonin levels up here, not down here, because it helps markedly, especially with those that are dependent but not addicted, to get off these medications. And many times, if you raise the serotonin levels and get that sleep disturbance solved, they will taper on their own and stop on their own if they're dependent but not addicted to these medications. So that's the ideas for what we do at the practice for narcotics.